Thank you very much for all the organizers, for all the persons involved in our Congress. It was very nice from the beginning, of course, and I hope to the end. Now I would like to present my work, our teamwork, about some relationships between zinc deficiency and chronic kidney disease, which is from a few university hospitals. So, you know, zinc is a metallic chemical element with symbol zinc and atomic number 30, an essential trace element necessary for plants, animals, and microorganisms. It's found in nearly 200, even 300 specific enzymes. Body zinc. Zinc is the second most abundant trace metal in humans. The human body has 2 to 4 grams of zinc distributed throughout the body. About 90% of total body zinc is found in the skeletal muscles and bone. Also, it's found in the brain, kidney, and liver, with the highest concentration in the prostate and parts of eyes. Zinc promotes release of vitamin A from the liver. Zinc affects cell growth, especially the epithelial, insulin function, the immune system. Zinc is crucial for taste perception. Zinc provides protection against heavy metal toxicity. It inhibits the activity of 5-alpha reductase and prevents prostate hypertrophy. Zinc is required for collagen production and elastin synthesis. There is a role of zinc in the metabolism of RNA and DNA. Signal transduction, gene expression, regulates apoptosis, wound healing. Zinc is good Lewis acid, making it a useful catalytic agent in hydroxylation. Zinc is antagonist to cadmium, lead, and mercury. It is component of more than 300 enzymes. The daily requirement is 8 milligrams per day for women and 11 for men. It should not exceed 20 milligrams in healthy people. For infants and children, 4 to 7 milligrams per day. The optimal range of plasma zinc is 90 to 150. Food rich in zinc are oysters, red meat, especially beef, lamb, and liver, seafoods in general, wheat and various seeds, beans, nuts, almonds, whole grain, pumpkin seeds it means, and sunflower seeds, also dietary products. About 20 to 30 of zinc consumed from a usual mixed diet is absorbed in the small intestine. Zinc is bound to and transported by albumin, 60%, it's low affinity, but transferrin, 10%. Transferrin also transports iron. Excessive iron reduces zinc absorption. It's very important to know that if you use very high quantity of iron, you will suppress the resorption of zinc from the food, and then zinc will be lower. Zinc is eliminated mainly in the feces. Urinary losses are less than 10% in normal fecal losses. Zinc increases the levels of the intestinal protein. Metallothionein in intestinal cells is capable to adjusting absorption of zinc by 15 to 40%. Zinc does not accumulate in the body to form permanent stores. So you have to know that you couldn't store in your body zinc. You have to take it from the food every day. Zinc deficiency cases are poor dietary zinc intake, excessive dietary phytate intake, chronic illness, kidney disease, liver disease, excess fiber, and diabetes. Malabsorption is also the reason for low zinc, over-supplementation with iron, and genetic disease. Zinc signs of zinc deficiency are as follow. The appearance of eczema and acne, poor wound healing, lines of view, growth retardation, splenomegaly, delayed sexual function. How to diagnose zinc deficiency? Zinc levels in granulocytes and lymphocytes is the best way, but practically easier and quicker is to measure in the blood and also in red cells. A low serum alkaline phosphatase also is sign for low zinc in the blood. You have to know that when you find in your patient's blood a low alkaline phosphatase, one of the reasons could be level of zinc, which would be lower than normal. The treatment is about 1 to 3 milligram per kilogram, 24 hours, and each 100 milligram zinc sulfate contains 33 milligrams elemental zinc. The zinc toxicity is rare. Food and beverage intake contained with zinc from galvanized containers, so you don't have to use galvanized containers. Chronic zinc toxicity means that zinc is more than 100 milligrams per day, and it's more common than acute toxicity. And it causes retard immune function and produce hemolytic anemia. It's very interesting, the effect of zinc on diarrhea. Zinc reduces diarrhea episodes, duration, severity, and corrects impaired water and electrolyte absorption. Reduction both short and long-term diarrhea severity in children especially. So if you want to stop diarrhea in children, you have to use zinc, like one of the points, one of the way to stop it. In addition to above-mentioned drugs, zinc finger and home box family of transcriptional factors in highly expressed in podocytes, and they are involved in glomerular disease. It's involved as well in some cellular functions, construction of numerous proteins, DNA repletion, as well as transcription factors. So this is the reason we are very interested in zinc deficiency in patients with renal disease, especially chronic renal disease. Serum levels tend to decrease with the progression of chronic kidney disease and are lower in dialysis patients due to zinc removal during hemodialysis, inadequate dietary intake, and malabsorption. We previously demonstrated that zinc supplementation ameliorates the response to erythropoietin therapy in hemodialysis patients. In diabetic rats, it improves pathological change in tubulointestinal, interstitial, and glomerular damage. So you see that zinc is important not only for glomerular, but also for tubular disease in kidneys. Moreover, some clinical studies demonstrate that zinc supplementation reduces urinary albumin excretion in patients with type 2 diabetes mellitus with microalbuminuria. These lines of evidence suggest that zinc supplementation may protect against the exacerbation of renal dysfunction. Oxidative stress in chronic kidney disease contributes to microvascular complications and reduction of the zinc-containing antioxidant enzymes. The aim of our study was to investigate zinc deficiency, its influence on one of the antioxidant enzymes, on the chronic kidney disease progression, and the effect of zinc supplementation on albuminuria. Material and methods.
Sorry, Dr. Yonova, but you must hurry up.
Okay. I'll tell everything in a few sentences.
Okay.
So we found in this study that zinc is lower in development of end-stage renal failure, and lower and lower and more lower, and in the end, in dialysis patients, we found it's very low in the blood. Supplementation showed that we improve microalbuminuria, but high level of albuminuria and proteinuria we couldn't influence. Thank you very much.